Hello, all. Welcome to Practolytics, your healthcare partner. Thank you so much for joining in the part 3 video, the Transitional Care Management series that we are doing. And in the last video, you have learned about the coding guidelines. And in this video, you'll be learning about the documentation requirements that are required for this TCM service. Firstly, this is Ellen Green from Coding Operations Practolytics, and I'm a certified coding specialist from AHIMA. With no further delay, let's begin the video. The agenda of this video is to help you understand the TCM medical decision making and the documentation requirements for this service. Now let's try to understand how to decide on the medical decision making for this TCM service. TCM code selection is based on whether the patient requires moderate or high complexity MDM for medical and or psychosocial problems, and whether the patient is evaluated with a face-to-face encounter within 7 or 14 days of discharge. Correct? So the medical decision making refers to a complex diagnosis and selecting a management option by considering the factors that now we are going to discuss. First thing, establishing the level of MDM is based upon the components like the number of the possible diagnosis and the management options that you are recommending, amount and complexity of the medical records, diagnostic tests, and other information you must obtain, review, and analyze. The risk of significant complications, morbidity, mortality, as well as any comorbidities that are associated with the patient's problems, the diagnostic procedures, and possible management options. Now, let's see the documentation requirements that are required for this TCM service to report. Keeping a complete medical record of the treatment and conditions to which a resident is subjected is not only good ethical practice and a legal requirement as well, but it can also play a major role in protecting a facility from legal trouble. The documentation contents for this TCM service, as TCM service is rendered after a hospital discharge, documenting the date of discharge is extremely important, and it is a crucial point in your medical record. Date interactive contact was made with patient or the caregiver, and the date of face-to-face visit, complexity of the medical decision making, whether it is moderate or it is high, is required. Last but not the least, signature of the physician who is performing the service. And then moving to the utilization indicators that are associated with this service. Only one physician or NPP may report TCM service. Report services once per patient during TCM period. Same healthcare professional may discharge patient from the hospital, report hospital or observation discharge services, and bill TCM services as well. Required face-to-face visit can't take place on the same day discharge day management services are being reported. And then moving on, report any reasonable and necessary E&M services except required face-to-face visit to manage patient's clinical issues separately. Physician can't bill TCM services and services within a post-operative global surgery period. Medicare does not pay TCM services if any of the 30-day TCM period falls within a global surgery period for a procedure code billed by the same practitioner. I hope this video helped you in understanding the documentation requirements and medical decision making that is supposed to be reported for your TCM service. We will be back soon with another video on the billing and the frequency limitations that are associated with this service. So please stay tuned to us. Thank you so much for your time and interest on our series.